Uh-oh. Can you hear me? Can you hear me? Oh, you didn't start the room in Clubhouse. Good morning. You got to unmute. Oops.
You're not doing Clubhouse this week?
I don't have this.
Oh, okay.
I was like, I don't have the stuff to do both of them. Okay, why do I hear it? Oh, that's you. Okay. How are you?
I'm fine. So
And
I
I'm going to
need to.
show something on here anyway. So,
Okay. So do I need to mute somewhere? Because if I do, I won't be able to hear.
mm-hmm.
Okay. There's no echo or anything, right?
Nope.
Okay, we're good.
I was like, okay, here we go. Saturday morning comedy. That's what I like to call this. All right, all right. So welcome to our Saturday morning tea, where we discuss health information, news, education, certification tips, entrepreneurship, um, where the money resides, gatekeeping, and all of the things. I am Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And do you know what it takes to be a certified marketable medical coder? Well, before I introduce my co host, let me share with you information on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. Good. Okay. So, if you are interested in getting more information about the 5 steps to become a certified marketable medical coder, and you are on YouTube, LinkedIn, and Facebook, well, friends, you can check out the video description for the link. So, unfortunately, I'm in Texas. Fortunately, unfortunately, I don't know how you want to say it, but I'm in Texas and I don't have the equipment to combine all of our platforms today. So we are just here on our visiting with our YouTube, LinkedIn, and Facebook friends. So you can let the uh, Clubhouse folks know, come on over and join us. Otherwise, they may often see us on other platforms as well. So that's why there's only one platform up and running today. But joining me today is my illustrious co host, Mr. Jesse, the registered trademark, the coding nurse. Sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philadelphia. I've been a nurse for a long time. And during the pandemic, I created the Coding Nurse LLC, where I help other nurses and people who have clinical backgrounds transition into the wonderful world of HIM.
All right. And how is that going for you?
It's coming along, and I really enjoy your intro with the 5 steps to become a certified marketable medical coder, because a lot of people don't know. They
But they
really
don't know.
don't know, and they hear what somebody said, and they think why you have to get your CPC. No, it depends on what it is you want to do. You might not have to.
That's
It's
right.
so
That's right.
it's so many opportunities. There's so many avenues you can go down, and it's just you can't take it for granted. But people don't know,
They
and that's
don't
an
know.
important step. to find out.
That you are absolutely correct. Let's see. Good morning, Vicky. Vicky says, "Good morning, everyone."
Good
And good
morning.
morning, Lashanta. Look at the crew's all here. Good
Good morning.
morning. Okay. Um, yeah, and then I provide some additional little gems on what that looks like. And actually we've talked about some of them over the course of our 51 episodes. Look at God. But I go in a little more depth on what those things look like. So, if you want to join in and add to the conversation, don't be shy. Your opinion matters and is welcomed here. So, if you have a question, of course, use the chat. Please type a Q first so that we know it is actually a question for us and we don't want to miss it, even though we're one less platform we have to monitor. So, hopefully, this will go a little easier. Let's see. Hi, Catherine. Post her.
Good
Welcome,
morning.
welcome. All right, all right. So, um, let's see. So let's get into it. So for those who are joining us today on the Saturday morning tea, or for those who are joining us today, we are talking about health information career paths. What's yours? So AHIMA recently released, I think it's an edited version because there are a couple of things in there that I hadn't seen before. They recently released an edited version of the health information career path. And it was looking at various careers in, I believe, 6 paths or so. But before I get to that, um, let's just talk career paths in general. So, pretty much, a career path is just, an itemized kind of walkthrough on where you want to go or where you want to be. It can include specific things like um, positions that you need to take in order to get. So it's going from point A to point B, and so it can include things like specific job titles or job descriptions or educational attainment that you need to get from point A to point B. Usually there are two different types of career paths. You have one that is organizational. So your company can kind of put together a career plan or career path or career ladder. They have various names that they call that. And usually either your direct manager, sometimes HR is involved. Sometimes they even have like a whole department dedicated to your career planning. And this is within your company. So oftentimes managers or others will identify um, leaders or next level leaders within the organization, and then they would, uh, for lack of a better term, groom them to those positions. And then so they would have take into account like where that person is today, and if they see something in them or see a spark or whatever, then they can kind of groom them and direct them. Okay, well, this is your next step. This is what you need to do. If you're interested in XYZ, these are the things that you may want to do within the next, sometimes there's a time frame given to get there. And other times you have situations where the employee says, hey, I want to be your boss or I want your job and want to know what does that look like. And so then they would take it upon themselves to uh, get with their manager and discuss what that looks like within that organization. Um, and the reason why this stuck with me this week was partly because of our conversation last week where the manager would not give the additional training or allow um, the employee to do some additional coding in order to better not only herself but also the organization as a whole. That just stuck with me the entire week. Like, really, where do they do that at? But anyway, so um, with that being said, some things that kind of help in preparing specifically organizational wide career path planning. You can help with special projects. Oftentimes they're depending on the well, most organizations have them. Like even special projects that are not related to your department. So I know like we used to have um, an annual giving. And so we would, that would be a special project where you can jump on one of those teams and help assist in providing information and planning for your department or other departments in what that looks like. And oftentimes it was competitive, and you would have certain things that you wanted to plan to beat out all the other departments in your giving. So that's kind of like a special project that you could do. Taking a course, be it in person or online, earning a certification, mentoring colleagues or new folks that come into your department and or organization, and then even shadowing someone for a day just to see, one, to determine whether or not that's the path that you want to take. But letting your manager know, and again, this hopefully would be something that would be collaborative, that you and your manager will work on. You wouldn't want to go have this back and forth battle. Um, uh, and they would assist you in that. And then the other one is your personal career path. So this doesn't matter what organization you were with. This is what you want to do. This is what you create for yourself. And, you would kind of sit down, self-assess, determine, hey, in the next so-and-so years or months or whatever, this is what I want to do. This is what I want to be. Kind of like what Mr. Jesse does on a regular basis. He kind of looks and say, you know what? I'm interested in that. Let me see where I am. Let me find out what it is that I need to do, and let me go do it. That's the one thing about you that I love. You will put it in the atmosphere, and then you go get it. My quote that I use all the time: don't wish for it, work for it. That's you in the dictionary. So it's a personal career path. So similar to what they would do in an organization, but you do it for yourself. And so you would kind of go through, look at what you're interested in, and then figure out how to get to those different areas. Well, AHIMA has kind of sort of helped us out, if you will, by putting together this career map, and it identifies some of the job descriptions, if you will, and skills and all of the things that are here. Let me open this up so you can see it. Okay. So it shows all of the different areas that we have in health information. Again, this is AHIMA's career map. I don't take any credit for this at all. And some of the areas you have: revenue cycle management, privacy, risk and compliance, informatics, data analytics, consumer health information, and data quality. And then the various rings indicate levels. So the very first inner ring is an entry level position. Then you have a mid, advanced, and then the last outer ring is master. The circles are current positions, or current, I guess, established positions. And then the yellow diamonds are emerging. And so if you hover over like the area, it'll show you which positions are aligned with the broader domain within the health information profession, careers, steps there. So one of the ones that got me, I had never seen before, was the community health worker. And so if you hover over them, they give you like a little synopsis, but if you click on them, it opens up an entire page that kind of tell you about the description of of the job, or title, the responsibilities, kind of what they do, the skills that are required, and then if there are any alternative titles to that job. Also in the blue box, it gives you training and education that is needed and work experience. So these are some of the things that um, you can kind of use to determine where you want to be, or if something interests you in health information and how you would get there. They also have this, did you know? And it talked about, the community health worker. Now, why this surprised me being part of I had never heard this as part of health information. Had you?
No, but what's interesting is a lot of Medicare Advantage companies are starting to use community health workers a lot more.
Hmm. And in my training in public health, we talk a lot about community health workers and their role in advancing public health. So it was exciting to see and hear it. I was like, well, did AHIMA just steal them? Where? How did that work? But it was. I was like, wow, that's different. So I know we have been talking a whole lot about data, and they have two paths here. They have the data analytics path, and then they also have the informatics path. One thing that I wanted to make mention of in both of those paths is that they don't have any entry level positions in either one of those arenas. So you're coming in um as mid levels. And in informatics, they have two of these emerging one. One is the data quality analyst. Um, and for training and education, it says a bachelor's degree or a master's degree preferred. Work experience, RHIT or RHIA preferred. 3 to 5 years related experience, excellent skills in Microsoft Office, and 2 to 3 years experience in a healthcare setting with data analyst. Um, and so this position analyzes and interprets applicable data to provide insight into and help drive quality improvement outcomes in both the hospital and clinic settings, guides strategy and operations by providing recommendations regarding data, format, and accessibility of reports to maximize knowledge and decision making based on the information available. So, and then it gives a list of its responsibilities, some skills that are required: excellent oral and written communication skills, excellent critical thinking and problem solving skills, knowledge of QU and or total quality management practices, ability to organize and prioritize workload to meet established schedules, timelines, or deadlines, ability to work independently with minimal supervision to completed assigned tasks, highly proficient in Microsoft Office applications, Tableau, or other data visualization applications, um, SQL, or do you say that as SQL? I don't know. I think I've
Either
heard both.
one.
Okay. And related data analytics tool sets. And then ability to perform detailed work with a high degree of accuracy. And other titles you may have heard: senior quality analyst, clinical quality analyst, quality data analyst, health informatics, and data quality analyst manager. So those are some of the things for that particular emerging career, is what they call it. And the other one was decision support analyst. This was also listed as an emerging career. Education, bachelor's degree in computer science, data analytics, healthcare administration, or finance. A master's degree is preferred. Work experience in RHIA is preferred, with 3 to 5 years of experience preferred. And the decision support analyst utilizes clinical and business application knowledge and systems skills to assist with database administration, prepare reports, perform data mining and statistical analysis, and communicates their findings to internal and external stakeholders, identifies and recommends the need for or a modification of procedures, protocols to assure data accuracy and proper utilization of data. And then it says some skills: proficient in Microsoft Office suite or other related software, ability. I just had a funny thought because somebody keeps trying to push Google on me. I was like, nothing about any of the things I've ever read said I needed to be proficient in Google. But anyway, ability to collect and compile relevant data, require highly proficient skills with Tableau, SQL, and Excel. Other data analytic experience desired: Tableau, SAS, Visual Analytics, Power BI, Python. Python was the one that they talked about that I mentioned, that they talked about a lot in AHEMA 22. And VBA. I don't know what VBA is. Excellent communication, collaboration, and delegation skills, and project management experience preferred. Alternate titles: analyst decision support, clinical decision support analyst, and decision support / data analyst. So those were two of the careers that are emerging that sit in the informatics realm. Mr. Jesse, I'll let you jump in. Oh, you're not muted.
Well, I'm going to go way back because you have really just uncovered so many gems. And I think I want to go back to we're talking about your career path. And what a lot of people don't understand is your manager is supposed to help you develop professionally. That is their job. Now, a lot of people fall down on the job and they don't really take it as seriously as they should. But I think that what a lot of people are going to have to start doing, a lot of people are going to have to start taking their careers into their own hands. And you're going to have to begin to network, because that's really the next level. Like, you have to network, you have to be able to establish relationships and reach out to people and say, I'm interested in this, can I, get a few minutes of your time to talk, and see what kind of opportunities they can present to you. Because a lot of times, managers just aren't what they're supposed to be, more often than not. So you really can't. It's great if you have a manager that's supportive, that's great for you. But that's not the average person's experience. And you really have to take your career by your own hands, take control of it. And you can use something like this, this document right here, to really begin to chart out, okay, well, what is it that I want to do? And, just get an idea. So, and they lay it out, like what skills you have to have, what type of education you have to have, so you can work towards those things.
Mm-hmm. That's true. I agree. I've had several roles where management didn't see I guess the potential, or they didn't see or didn't work with me on getting to the next level. And to Tasha's point, you're absolutely correct. You have to be your own advocate. And to your point as well, Mr. Jesse, and you know what you can and cannot do. And you should have that self-assessment to say, okay, this is a weakness, this is a strength, and find out what it is you need to move the column. So move those weaknesses over to strengths, and put in the work and do what you need to do. And so you're absolutely right. In this day and age, and when I talked about the careers, and especially the organizational career paths, oftentimes that's done with organizations that are interested in their people, interested in retaining their people. Nowadays, I don't even know if that really exists anymore, and not necessarily from the people doing the exodus, but there's with the layoffs and all of those things, like do people do these organizations really, I mean, you spend a lot of money in obtaining a new employee, with the recruiting, with the hiring, with the training, with all of those things. It's a lot of money. And then once they're in, do you still have that same energy to keep them there? Are you still providing? I mean, how many people do you really know that just said, "Hey, I got this job and this is where I want to be for the rest of my life"? How, I mean, really? No. At some point, there is some sort of advancement. If it's either advancement in other positions or advancement in coins, there is an advancement that actually happens. And, how often is it that you run into gatekeepers, roadblocks, barriers, all of those things that won't necessarily get you to that next level within that organization. And oftentimes, when that happens, then folks seek other organizations where opportunities may be available. And I mean, you would think it would be a win win if you got the person already there. If you don't know, you should know what they're capable of and what they can do. And you help mentor and train them and guide them along that path. So they're at least within the organization, they build up time and tenure, all of the things that I think that experience stays in house. That experience doesn't go anywhere else, because people, they've been with some place for a while, they build up internal knowledge that someone from the outside does not have. Um, and will take time to get. They could get it, but it will take some time to get, and you already have that person. So you would think organizations would do that, but in this day and age, it's like, I don't know, hit or miss, hit it and quit it. I don't know what's happening, but either
I
way,
think,
go ahead.
I'm sorry, go ahead.
No, you're fine.
There's a whole mindset shift in employment in people who are, I'll say, under 40, because they are told to not stay at a job more than 3 years. And they already know, because how they have come up with it. And I've seen quite a few videos where you'll have people who, because we know that annual raises on jobs are not what they used to be.
Amen.
And they don't keep up with inflation. It's really pennies. So these people have realized that to get a good bump in your salary, you really have to change jobs. That's how you make your money. So they have decided. I've seen plenty of videos where people are like, if you're at a job more than 3 years, you're wasting time unless you really, really love it. Because you can bump up, like I've seen videos where people have bumped up their salary in like 6 years, like $70,000. You're not going to get that on any job.
No.
And what they do is they get the skills and they go get a recruiter who finds them a job.
Wow.
So they're not even being trained to stay any place 10 years.
Wow. You just dropped it. So I never heard of that. The recruiter piece. So but it makes perfect sense. You have organizations who have recruiters to go out and recruit for the job. Why not flip that on its head, and you have the recruiter work for you, to find the perfect fit for you. Wow.
And if you have a good resume on LinkedIn, they're going to come out of the woodwork and find
Oh my
you.
God, they be in your box. They be in your box. So LinkedIn is a perfect example of a great resource. So if you're not on LinkedIn now, I have to tell people, especially those young folks, LinkedIn is not Instagram, it's not Facebook, it's not Twitter, it's not those things. It's a professional, a professional social media um, tool that it's a net for me. It's a networking tool because oftentimes, anytime I meet somebody, so you long gone, well, not long gone, because I do have one or two business cards, but most people don't carry business cards or do the business card thing anymore. If I meet somebody, if I have an interaction with somebody, the first thing I do is look them up on LinkedIn and connect. Like, okay, hey, I've heard you speak, we've talked, we whatever, this is where we're connecting. And then from there, you can learn more. Most people share professional career information. People share their jobs. People share all kinds of things. And then the machine behind the engine, if you will, in LinkedIn, um, there's some questions. If you're looking, you can notify them and let them know that you're looking for positions, and you submit your resume, submit cover letter, submit all the things, and they will kind of match different jobs, or introduce you to different jobs for you to go out and look. And then there are also recruiters out there using LinkedIn religiously. And so they're looking to see and then in your inbox they come, hey, we got a job for XYZ. Are you interested? This and the third, blah, blah, blah. And, I think the other thing that we might want to, or you may definitely need to consider and should be working on, if not already, is mastering your negotiation skills. I think oftentimes we fall short in the negotiation process, um, and I can say for me, in one area or more of my life, I've done that where you just took you they met where you wanted to be, and never in my mind did I think. Somebody said it to me before, if they can meet where you are, then they got more to give you. If they can automatically meet you right there where you are, then there's more in store, and not necessarily um financially nowadays. I mean, the coins are great, and getting those coins, but there are other um incentives that are available and perks that are available, time off, flexibility, all those things are now negotiable. And so just make sure that you do negotiate when you have those conversations. So that might be something we can talk to the folks about too. Here, what does Vicky say? Vicky
Oh,
says
absolutely.
companies and organizations just want to get as much work done from you as possible, not thinking about your best interest and growth. True. And that's why, you have to advocate for yourself. Mr.
And
Jesse, you were saying
what a lot of the one thing that a lot of people really overlook is what type of company do you work for? If your company is listed on any stock exchange, they don't care about you. Their obligation is not to you. When you
something.
have a company that is listed on the stock exchange, their first and foremost obligation is to their shareholders. They are bound to make a profit. They are bound to return dividends to their shareholders. And if they have to cut corners, cut your salary, cut your benefits to do it, that's what they're
Cut
going to
you.
do. And I realized that just by accident because I worked for a company. They were private when I started, and it was great. I mean, really, really, I mean, just great. They went public, and everything got skimpy. You could
Mm.
tell everything, and it just wasn't the same. And case in point, they ended up going private again.
Wow.
They the stock is yep.
That's interesting. You could tell when stuff gets skimpy when you start out with the good pens and then you get them little cheap plastic pens. That's always a first sign for me.
I mean, we used to get like nice, like not, some people have always had cheap branded items. We used to get like branded beach towels
Oh,
just
wow.
because like, they would send stuff all throughout the year because most people worked remote and you would get like tickets to movie theaters, like
Oh, wow.
just stuff, but all of that stopped.
Mm. Yeah, you would. And what is it about employee satisfaction? I mean, I get your first obligation is to the shareholders, but if you don't have no employees, nobody is advancing. So Wow. Wow. And that's interesting that they circled back and went back private. That's interesting.
Yeah. It's the company's in Overline. You can look it up. Like
Okay.
they
Actually,
went public.
I have a client that is using one of Novolon's products. So yeah,
Okay.
I dibble and dabble.
I can speak for them back in the day. I can't speak for them now, but I was there when they were private, and I was there when they first went public, and it not wasn't pretty.
Mm. Yeah, I can only imagine that shift. That would be painful. That would be hard.
Because
So
we even go
no, go ahead.
because I was on their travel. One last story. I was on their travel team, and we used to have nice accommodations. I mean, I would always have a nice car, like a nice rental car.
Hmm.
I went somewhere and like I had this. I went to get the car. It was like a Ford Focus. I was like, oh no, 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 no. I had to call our travel department. I was like, this is not going to work.
Like,
Upgraded me.
where you think I'm going? What do you think I'm doing?
Exactly.
That's funny. um, let's see. The other thing I wanted to point out. So in our revenue cycle sphere, there was one emerging uh career there. It's the PPS coordinator. Um, and this person, the position ensures compliance with all state and federal requirements related to and oversees the accuracy and timely completion transmission of the inpatient rehabilitation facility slash patient assessment instrument or IRFPI. Coordinates staff education and training related to scoring and documenting observations of functional independence measures, or do they say FIM or FIM? Training and education, associate's degree, bachelor's degree preferred. Work experience qualifications vary depending on the facility and job duties. This role can be filled as a clerical role, or clinical aspects can be added to the role requiring a nurse or other clinician. um, let's see. Talks about some of the responsibilities, skills required: experience with ICD-10 coding, knowledge of MDS, PPS scheduling, completion, coding, and submission requirements, demonstrated knowledge of state Medicaid program, Medicare PS program, managed care programs, RUGs 3 and 4, classification and reimbursement systems. Alternate title: prospective payment coordinator, PPS program coordinator, MDS and PPS coordinator, and outcomes manager PPS. So that was the emerging. So I saw that, interested. It's specific to um, a setting, if you will. I hadn't seen that whole requiring a nurse thing. Here we go. Here y'all go.
Right. And it's all in David policy.
Like that's what we doing. Let's see the other thing. So in revenue cycle management, your entry level is the medical biller. Again, the medical biller performs accounts receivable functions, including billing, reimbursement, collection activities, and customer service. Then you have charge master analyst, revenue integrity specialist, the emerging career we just mentioned, revenue cycle trainer, revenue integrity analyst, and in the master area is the director of revenue cycle management. And let's see what that says. That says the director of revenue cycle management provides strategic leadership and guidance at the senior level in all areas of the organization's revenue cycle functions, to include health information management, financial counseling, insurance verification, revenue integrity, coding, patient accounting, and research billing. The Director of Revenue Cycle Management is responsible for development and implementation of key strategies for achieving innovative revenue cycle solutions and both short and long-term goals, objectives, and outcomes. The Director of Revenue Cycle Management utilizes their understanding of hospital medical staff bylaws, CMS standards, HIPAA, the OIG, state regulations, and any other state or federal rule, regulation, or agency as they pertain to all revenue cycle functions to ensure compliance with all hospital requirements and regulatory agencies such as CMS and the Joint Commission. Training and education, bachelor's degree required, master's degree preferred, 7 to 10 years of relative experience, and minimum of 5 years in a leadership role. RHIA, government payer experience, including knowledge of local medical review policies, CMS policies and requirements, and ambulatory payment classifications. Experience presenting or consulting to C-suite or large physician organizations. Experience with Power BI or other systems is a plus, and experience gained through exposure to account management and or systems in the change management and quality measures. Let's see, Revenue Cycle Manager Enterprise is also an alternative or alternate title. And here are some of the skills that are required listed there. And you can find this, I guess I didn't tell you. You can find this document at my.ahima.org /career map. That's where you can find it. And I don't believe you have to be, I don't think you have to be a member of AHIMA or, because they didn't ask me to sign in. So I don't believe you have to be a member of AHIMA to actually see this document. Let's see. Some other things. So in data analytics, you have the health data analytic. Oh, an analyst. And so some of these I meant to also mention have the STEM. So I think all of your data analytics and I think your information, and your health informatics positions are what they're calling the STEM position. I saw this and was like, do they still have a medical records clerk? What in the world? But
sure somewhere they do.
I guess they do. I was like, well, what is that? And here's our medical coder who also has the STEM piece. Let's see, training and education, diploma in medical coding and billing, or credential in medical coding and billing required. Work experience. Now remember, this is a AHIMA document, so they're going to post AHIMA credentials. CCA, CCS, or CCSP required. RHIT preferred. Previous experience is highly desired. Responsible for coding outpatient and or inpatient records for the purpose of reimbursement, research, and education in compliance with federal, state, and regulatory agencies guidelines using the most current taxonomic and classification systems. Skills require excellent command of diagnostic and procedural classification systems with thorough understanding of the effect of data quality on prospective payment, utilization, and reimbursement, knowledge of medical terminology and disease process, proficient knowledge of anatomy and physiology, DRG and APC assignment, proficient knowledge of ICD, CPT, HCPCS coding systems, proficient in encoder technology and knowledge of third-party payer requirements, demonstrated skill working with Microsoft Excel and Office Suite products. Again, it does not say Google. You feel me? Oh my God, that's a bad beep. Anyway, possess strong written and verbal communication skills to communicate effectively with individuals at all levels of the organization, ability to adjust to changes in workflow, thoroughness and attention to detail, and ability to work independently. Alternate titles: Coder 1, Coder Specialist, Inpatient Coder, Outpatient Coder, Facility Coder, Professional Coder. You have all of those things there. See, medical coding job roles range from entry level to highly proficient. Job descriptions and salary vary vastly by geographic location, type of facility, education, credential, and experience. Look at us, those who are coders out there in the world. um, yeah, all of the consumer HI were entry level things, and that's where you had the medical records clerk, the patient navigator, the patient service representative, and the community health worker that we talked about earlier. Was there anything specific you wanted to see, Mr. Justin?
No, I just looked at data quality and saw how, they still are preferring RNs for these CDI positions.
Mm. Are those the emerging ones?
Mm-mm.
Oh, just the regular ones? Because they have this. Here's an emerging career: clinical documentation improvement, quality assurance auditor. I'm looking to see. Yeah, they do say nursing in there too. This position uses clinical code assignment, documentation requirements, and reimbursement methodologies to review the work of clinical documentation improvement specialists. The goal of the audit is to improve documentation and patient quality and capture severity, acuity, and risk of mortality. Documented results will be used to track and trend the success of the overall program, provide educational follow-up, and identify changes in medical practice that should be reflected in documentation. So have you seen this position in organizations, or is this where
Which
you have
one?
this clinical documentation improvement quality assurance auditor? Or is this where
I've
you
never
want to,
heard.
yeah, where you had to have the nurse check off and verify and validate that what you did was correct? Let's see, training and education, degree in healthcare fields such as nursing, health information management, or equivalent combination of education experience combined required. 1 year of education equals 1 year of experience. Work experience, RN, RHIA, prefer CDIP and CCS, 3 to 5 years experience in a clinical documentation improvement program with previous experience in clinical quality, utilization management, case management, nursing, coding, or related field. For example, physician, of which a minimum of 3 years experience is in a management or supervisory role. Let's see. Um, that's the same thing. CDI Quality Assurance Auditor is the alternate title. Required skills: strong interpersonal skills, excellent communication skills, competent computer skills, including Microsoft Word, Excel, and email, strong analytical skills, understanding coding classification assignments, knowledge of reimbursement methodologies such as MSDRGs, POA, and HAC, ability to conduct and interpret quantitative/qualitative analysis, proven project management skills, results oriented, ability to work independently and organize oneself, exhibit collaboration, candor, and openness. All right. So yeah, that's an emerging career. So we talked last week about the different careers where folks are moving out the way and they still need the backfill. I guess this is where those folks gonna move out the way into these oddity careers. Okay, wait. She said, hold on. LaShanta says some of these coders missed the memo. They could care less about half of that. Anything payer they feel it's billing, shaking. Yeah, you got to know the information. You got to know what the payer wants. You got to know what those requirements are. She said, wait, years of school equal to experience. Can we talk about that part? Because I know some people. I believe the tea spilling session is about to begin right now. All right. So I just wanted to share that with you all. Yeah, I thought that was good. I was glad. Actually, I saw this on LinkedIn. A matter of fact, I think
Okay.
Akima put it out on their LinkedIn page. Let me stop sharing. Put it out. They cannot be let loose in these streets like that. Exactly. Like, oh my goodness. Exactly. Because yeah, some folks gonna take that and run with it. But hopefully. So my prayer is, I know, and I talked about this. I think I posted a video. I did post a video about the experiences and some of the takeaways that Ahima had at Ahima 22, and one of them talked about their lack of advocating for the profession. And so I hope that this ain't it. I mean, this is great that they have the career map, and it's available, but there still needs to be conversations had and discussions with the other stakeholders, such as HR and these organizations who are hiring, so that they know. So it's great for us from a career perspective to know, okay, well, if I'm interested in XYZ position, these are the things I need to do. That means not a whole lot if the folks on the hiring end don't make the same connection and understand that me as a health information professional have the same qualifications and skills to match the jobs that they're looking for, or they don't understand the connection between that job, the skills, and the job and skills that they're hiring for. Any comments on that,
See,
Mr. Jesse?
I think like I agree with you. I think that this document is nice, but I think that it should have been part of a bolder initiative. I think that there should be more to it. I think that it should have been a series. I think that they should have released this, and then if no more than one, then each month pick one of these large domains and talk about them, and have people, have a 3-minute interview with somebody who's actually performing that job. Like, that's how you promote your profession. Like,
Mm-hmm.
this is nice to put it on LinkedIn, but how many? Not everybody's on LinkedIn. I mean, it's it's the half behindness for me. It's just like, okay, let's just put something together, because that's what, and it's a nice document. I'm not saying that it's not, but it doesn't go far enough to
I agree.
promote the industry. It doesn't go far enough to actually help somebody formulate a career. And they also have to talk about, because we have to, because there's documents like this, then there's the real world. Like, in the real world, you have people who have a hard time if they have their CCSP alone. They have a hard time getting an outpatient job. The CPC is the standard. Nobody talks about that.
Correct.
So it's that kind of advocacy that AHIMA should be in front of, and I just don't see it.
I agree. When I saw it, I was like, because again, they had something like this before, or similar to this, and I just think they added these emerging careers. They may have revamped some things. They added STEM because now they are recognized as a STEM profession, um, officially, um, and probably did some additional tweaks and updates. But to your point, not everybody's probably saw this on LinkedIn. I think it's great to use social media um as a guide to disseminate information, but that should not be the only channel. And that was the only thing that I saw this on. I mean, I guess I don't, and I'll be honest, I don't go to a HEMA website on a regular daily basis at all. Unless I'm looking for something, and then I'm doing some research and digging um through articles and such. But just for that to be like my top 5 it ain't it. So to your point, that would have been great to put together a series. And maybe, the optimistic me, maybe that's coming down the pike. Maybe but then even if they put it in the journal, not everybody gets the journal. You have to be a paid member to get that journal. So, you know, putting together something in a different, I think they just got to think outside of the normal channels and the regular box. They have to be able to push this information, make sure folks get it, push it down through even the CSA level. I mean, this is something that, you know, if you want to start with your membership, then start there, push it down to not the mass as a whole, and then be more strategic and have, like I said, those direct conversations with the HR community and getting them to understand and, like I say, connect the dots. I don't know. I just think there's still more work to be done. And I just hope this wasn't it. I hope this wasn't just, okay, this was our checklist of things that we wanted to do, what we said we were going to do, and this is it, check and move on. I pray that that's not the case with this.
But I think I think that there's a shift happening just throughout the work world, period, where I think that organizations are starting to get called out because like right now in nursing, it's about to be the Hatfields and the McCoys because these because these nurses are tired. They are tired of being overworked. They're tired of getting their behinds beat. They are like they didn't had it. And they're calling out these major organizations who basically are not advocating for them. They're not, I mean, there has been so much that has happened in healthcare since COVID, but there has not been any real change called for in terms of staffing, in terms of, even when they tried to vilify nurses for making all this money during the pandemic, they like these organizations just basically just left them out there, to flail. And I get it. I totally get it. And this is why I believe in term limits. I believe that there's such a thing as too old. And when you are a certain age, you have a certain mindset. You're not going to change it, whether society changes or not, whether we can levitate or not. If you don't believe in levitation, people can levitate around you, but you're still not going to accept it because that's just you. And you need to just go somewhere and sit down and enjoy the fruits of your labor. Look, we appreciate the work that you did to get us this far, but now we need somebody that's going to take it further. Exactly. Yep. And it's so, God bless you. Just, live long and prosper. But just go get away from here, because you're not helping.
You're absolutely correct.
I think that is what is happening. I know I see it in nursing, and I think that it needs to happen in HIM because these people just continue to miss the mark with all that's going on. And you can't tell me it's not intentional. And they think they're doing something. Trust me when I tell you. They are high-fiving each other over this little document that they put out there.
That's why I say I think, and like I said, it's not that it's a bad thing. I think it's a great thing to have, to know, to be armed with when you're, putting together, when you're doing your self-assessment and putting together your own individual career path. However, it's not just on us. It has to go to those who are in those decision-making positions, and they need to understand and know. I don't know. And then as I looked at some of as I read the data, the CDI quality assurance auditor position, I feel some kind of way when you put nursing ahead of your people. I don't like that. I know we in here together, but your people are your people, and you need to advocate for your people. Not that, there aren't nurse coders, because of course you, Mr. Jesse, are one of them. But still, I don't know. I just think I feel some kind of way in my spirit about that.
This is what I find funny. Nursing doesn't even promote CDI the way AHEMA promotes nurses in CDI.
Right.
That's
Like,
that's the gag for me. It's like, really? And here's the kicker, and what people have to understand, and I want them to really get this. I am an LPN. In the grand compared to RNs think that I can barely walk and chew gum at the same time, even though I have I have had a license for almost 30 years. It means nothing to them because they it's but that's the industry. That's what it is. And I don't understand how you can just I mean, especially when you consider the work that's being done.
mhm.
Nothing clinical is being done in HIM. Nothing. You are not exercising any judgment. You This entire industry is run off of provider documentation, point blank.
Period.
So I don't understand how all of a sudden now you have Nancy Nurse is such an expert on what? And the thing is, Nancy Nurse is not even a coder. Nancy Nurse wouldn't got a CDIP or a CCDS and doesn't know anything about coding guidelines. Like I was in, I'm still in orientation, and my preceptor, we were reviewing a chart, and the person had unspecified CKD and they had diabetes. So they had E11.22 as a suggested code. So he was like, "Oh, well, you can accept that." I said, "No, you can't." As because according to the guideline, when you look into the tabular, you have to for you to use diabetes, you have to have a stage of CKD. It's not unspecified. You can
Right.
use that with the I-12 category, but not with diabetes. So I'm like, you can go look. He flips. So he says, "Well, it's not excluded." I said, it's not excluded because it's not there at all. Because you can't do it.
Wow. Wow.
But that's when you get into the meat and potatoes of what CDI really is, because E11.22 is a chronic condition, so
Hmm.
that can elevate the DRG. But if you were to get audited and that's your only CC, you're going to take a hit because somebody's like, no, you can't code it like that. But
Yeah.
that's the difference between being a CDI only and being a coder and a CDI.
True. And I think in the ideal world, in the ideal space, everyone has their place. So there's room at the table for both the coder CDI and the nurse CDI. In the ideal world, and I think CDI departments that recognize that and have that type of makeup um, probably run better. Um, but the competition for the positions and the competition for who's right, wrong, I'm clinical, that's a mess. That's a mess. It's like it's it's like you out here, oh, survivor trying to to survive, um, being at the table and being in the positions. Like I shouldn't have to do that. Um, what's that proverb? Mike, let my gifts speak. My gifts will speak for me. Come on now.
Mm-hmm. And I tell these stories all the time. Like I know because I've worked with registered nurses all my career, and I know the the arrogance that comes along with it, and I see it every time I start a class. Like I can see it, like they don't put the effort in the beginning, and then when they get these scores back and they get these questions back, and they're like, and I teach them step by step how I like I tell them how I ordered a chart today is how I did it 6 years ago. You have to have a process. and you have to stick to the process. So you make sure you don't miss anything. And if I teach you the process and you don't do it because you just don't want to do it, and you think you don't have
Right.
to do it, but the thing is, and I tell them, I said, but you don't have to. I said, but the thing is, you'll never pass a test, you'll never get a job.
Right. And
You're going to learn how to follow the rules.
everything is in a system. The world works off
Right.
of systems. And so that process is part of the system in order to make sure that you are coding that accurately. I think the other thing that just came to my mind was, we are not, and I don't know if nursing, if this is something that's actually taught to nurses in their training, but health information professionals, we are not assertive. We're there. A lot of them, they're timid to a fault. Even when I see people and I have the conversation about, um, are you interested in transitioning to auditing? Like I've had these conversations with people and they're like, oh no, audit, I'm scared. No, what? Like, if you know what you know, you know how you got there. You got the black and white documentation to black, white, and sometimes gray documentation to show you, and to support you and back you. Why not? I just, there's a just, they're timid, they're not assertive. And so when they butt heads against the arrogant nurse, there's no win there. They're gonna get run over, get with or get run over, and they're gonna get run over every time. So I think there is an opportunity there for us to have those conversations as in the Black Coding Association. We gonna have some training in that, how to be assertive and how to you know how to carry your own and know what you know and be okay with that, and then be okay if somebody doesn't like it. It's for me, and that's compliance. When I provide compliance advice, my job is to give you information. My job is to tell you what it is, and even from a health information perspective, my job is to tell you what the guidelines say, provide information, and give you a recommendation. What you choose to do with that information is no longer part of my job. I did my job. Of course, pay me. I've done my job. Now, what you do
Yes.
with the information is on you. But no, I'll be back here on the sidelines if you need help cleaning it up. But I told
Right.
you, and it has documented well that I told you this is what it is that you need to do and how you need to follow.
Because case in point, like I have been working now, so I've done quite cases. So now I'm starting to, like I got a couple of DRG mismatches. So that means my what I came up with, the coder didn't agree with, which is fine. So you go look at everything again. So I, looked at it again and gave her my rationale why I made this. I chose the PDX I did, principal diagnosis. So she writes back that she's going to add my primary diagnosis as a secondary diagnosis. Fine. So my preceptor was like, well, this is your case. If you don't agree with it, you can escalate it. I said, mm-mm. So I'm not going back and forth. That's because at the end of the day, the information is right there. If it can slip through and they get paid, then fine. But guess what? When if they get their hand smacked on it, when they come back and look at it, they're going to see Jesse said this was the
That's right.
PDX all along. I don't care. I'm
That's
not arguing
right.
with nobody else.
That's right. That's right.
So I told him, I said, I will never escalate. When I respond, if they don't agree, I'll change it to what because at the end of the day, their name is on the final coding. CDI doesn't do final coding. That's on you. You have to answer for it, not me.
That's true.
I'm going to make sure that I have in there what I think is the right one. And when I see you disagree, I'm going to make sure I screenshot it and keep it. So we ain't going to have no problem.
And God, it's like, so what you think the purpose of my job was?
I mean, the crazy part is on the discharge summary, their admission diagnosis and discharge diagnosis was the same thing that I picked. I don't know. This person had an she put an aneurysm as the principal diagnosis, but you don't treat an aneurysm with embolization. Aneurysm is already a rupture, so you're going to put something in
Right.
there.
Right.
Okay, come on.
I
Have
mean,
at it,
sometimes
sis.
you got to think a little bit too. There's some critical thinking skills happen there, or just some plain, common sense skills being effective as well. That it ain't all common. We all know that.
Right.
Wow. Wow. Well, again, I just, felt the need to share this information. Um, Hopefully, some powers that be. I know I will definitely provide this information to our CEA. Just, hopefully others in the profession are doing the same thing. Definitely provide it to our community. Go ahead.
LaShanta has a nice comment about fracture care because I had a situation about a fracture this week too.
He said, well, I was in this situation this week. The coder asked about fracture care. I agreed, but she picked a code with a cast. I'm like, you wrong. Where is the cast document? Wow. I don't know. These.
But
So go ahead.
it all comes down to guidelines at the end of the day. Like people don't read the guidelines. That's what it really all comes down to.
And are they having these conversations? Are they having I mean, I know folks are remote, that's fine, but do y'all still come together and powwow and let's talk through, here are some things that we're seeing, at some point somebody needs to have these conversations. Let's do some kind of internal training about, or some if not training, we're reassessing and going over, okay, don't forget, this and the third needs to happen before you code this, or just some of those types of things. They don't do that anymore.
Well, they're supposed to, but because I know, like for like where I work, we have a huddle every morning for 15 minutes. It can go longer, and we just had a big meeting yesterday, and the manager was like, when you have your huddles, if you have a case that you need to discuss or want to discuss, that's the time to do it. She said, because you can get feedback. And well, you know me, I'm gonna ask questions anyway. So because I use the book. Even though we have 3M, I use the book to find my codes.
Amen.
I found there was a situation. This lady had a gastric. She had a sleeve done, and the sleeve was converted to a bypass, gastric bypass. And she's been having problems. She has to go every so often to have EGD dilations done. So after one of the dilations, she developed nausea and was having problems. So the provider had diagnosed her as a possible healing perforation. So when you go to perforation and it says procedural, that is a complication. So the code in the book said your or laceration. When I had my case reviewed, my preceptor was like, well, I don't like that because it says, because in the encoder it said puncture and laceration. So I said, well, that's not what the book says. But see, he doesn't use the book, he uses the encoder. So my question was, when we had our meeting, I said, what do you go by? Do you go by the encoder? Do you go by the book? What is the definitive authority? So they said the book. But if you don't use a book, then how do you know what the if you're not a coder and you don't know how to use the book, how are you? Because you go in, you can punch in anything in the encoder. It can lead you down a rabbit hole. Hopefully you get to the right place. I don't like it because it's too much clicking for me. Yeah. I like to index and find it that way. But
find it that way is easier. But I thought there are places that you can actually get the guidance in your encoder. I mean, again, those are additional clicks that you got to go find if you
Right.
know whatever. But yeah, because all of that's supposed to be part of your encoders having all of that information.
Right, but if you don't go click on it, see, that's why I don't. I mean, I'll use the encoder because you have to put the codes in.
That's where you
But
put it
when I
in,
go
right?
in, I just have mine written out. I just go punch them in and keep it moving.
Yeah, I agree. LaShanta. I think it's beneficial to you both encoder books and desk reference. The desk reference gives all of the tea. Yeah, that's crazy. That's crazy. That's another tool you need to have in your toolkit, and hopefully, well, these, we talked about that earlier, how these employers are skimping on stuff. Do you get a desk reference? Are they allowing that?
Exactly, Tasha. It all comes
That's
down to
it's
the
the
guidance.
guidelines. It is the guidelines. That's right. I failed the exam the first time. Somebody told me to keep reading the guidelines. It's all in the guidance and it's right there in front of you. Um, but you first need to understand and know what the guidance is related to those. And then there are certain things that, I tell my students all the time, there's certain gimmies that, low hanging fruit, if you will, that that's going to be asked on a test because it's tried and true testing material. And then you also have to pay attention to whatever is new. So there will be some sprinkling of new codes, new information, new guidance. That type of stuff will be on your exam as well. But you definitely need to know and be aware and abreast of those guidelines as you're coding. Yep. I buy my own. You better do it. That's how you do.
No,
Yes.
I sure do.
Yes, sir. Yes, sir. Got to get your own stuff. That make an investment in you. Make an investment in you. Um, in these out here in these career streets. So again, I hope the information we provided today um, is helpful to someone, not only someone who may be new to the profession or interested in the profession, but also to those who are seasoned. Prayerfully, this is something that you already know, but maybe there's something that you learn, particularly with the career path. And if you're looking to advance your career, um, again, AHIMA has provided this tool to give you some information and some guidance on how to get there. Yeah. And stick to the AMA version because Optum play too much. That was LaShanta.
And I only use Optum. I love
Uh-oh.
Optum.
I see a battle brewing right now. But yeah, you have to be mindful and careful of some of those publishers. I'm like you. I do use my Optum uh, ICD-10 books. Of course, AMA is the only game in town for CPT, so that's all you got with that. But then they have some additional great resources as well. I'm always down for my CPT changes. That's like the Bible to me, especially when I'm looking for new information. What has changed from year to year? Um, yeah. So you got to be armed with your tools, and you don't. I don't even think you see that information on an encoder. Like you said, you're just putting the stuff, and it's just guiding you through the algorithm to get that. You don't get that additional stuff, and so computers encoders are great, but that book is something. There's something to be said for knowing how to use and navigate your manuals.
And we say it all the time. I just don't think there is enough provider education because I read these notes. I mean, this copy and paste of all these progress notes is ridiculous.
It's killing
Everybody,
me.
you say the same thing, which is really nothing.
Mm. With a due date. Be like, ma'am and sir, why? What? It kills me. I have one client, like we look at the notes and it's just copied over from encounter to encounter from encounter. And it's like, really? I would be pissed off if I was a provider and had to, like a new provider getting a patient and they had to go through all of this foolishness. I would be mad. It'd be like, you know what? I'm sorry. I'm gonna try to go through this and pull out what I think you've already had, so we're not duplicating any type of services. But we starting fresh because who's going through this? Oh my goodness. Mm-mm. Or hopefully, or I'll reach out. Like, could you put this in a report? Can you give me a concise summary of what you've done with this patient? Because I can't fool with none of this stuff you just sent me. Bless their hearts.
But what I do like, well, I've said it forever. I have never liked the CPT code set. I've always loved PCS, and I have my PCS book, but I just need these. I mean, you read some operative reports; they're beautiful. Like they lay it out like a 3-piece suit. Like you could have one hand tied behind your back and code it correctly. Other ones, you're like, no, wait a minute, what happened? What approach did you use? especially with fusions. Oh my god.
And you don't realize those are, even in our education and training realm, it's easy to kind of put together the scenarios and see, but understand that those are ideals and real world is on a whole different, sometimes foolish level. It's like pulling teeth, trying to pull all the pieces together in order to get what you need to code it accurately, which is where you CDI people come into play to help out. She said PCS stresses her out. That was LaShanta.
It's all about the root operation. When you get the root operations down,
It's a breeze.
It makes because you can't get it any other way than by the root operation.
That's right. That's right. That's right. Okay, well, I guess we're going to wrap up. We're past the top of the hour. We just been here chilling, doing our thing on a Saturday morning.
Well, we're giving out so much tea,
dropping it, dripping, drip, 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 and it's hot. It's spilling the hot tea. So look for my the little breakout where I carve out certain things where we spill the hot tea. You'll definitely get a hot tea separately by itself. So Mr. Jesse, do you have any closing thoughts for today?
I have enjoyed it. I have, I just always say I'm glad you created this space so people can come and get some real information, some real resources to help them really, really navigate and have a successful career.
Yes, that's all we're looking for. Trying to be resources and to help people in their career path. So, yay! I'm excited about that. Being able to be a conduit of I don't know, change. So thank you all again for joining the Saturday morning tea. And let me ask, was the tea spilled today? Yes, I believe it was.
Absolutely.
I believe it was. And as always, if this information was valuable for you, help us share the information. And you can share this information with others by liking the video. Share the video. There's always places where you can take and just populate and share the information to your networks. Like, we don't know everybody and everybody don't know us, but here's an opportunity for us to connect some people together. And so they can provide some information firsthand, and we can have a bigger conglomerate when we put together our community. So share the information and share the video, and subscribe to the channel. You can subscribe to at PRN Coding EDU. Actually, that is, I think, all of all of my handles on all of the things in the social networking world. Also, don't forget to check out the Coding Nurse channel on YouTube. There are gems over there. Make sure you go through and check out the videos and information that Mr. Jesse puts on his channel. And last, but certainly not least, don't forget to network with each other. You know, we're here. We kind of know and see each other. There's always something to be gained from um, networking with people and being a resource for people. So don't forget that as well. So this has been a great session today. I appreciate you all and me spending some time with you all. We will not. Next week is after the holiday. We will not have a Saturday morning tea after the holidays because you all probably will be in the store. Oh, I know I won't. I'll probably be working somewhere, but I'll still be here in Texas. I'll be in Texas for several days. I'm spending time with my daughter. I'm going to spend the holidays down here with her. So I'm excited about that. I hadn't seen her since Christmas. So we're going to have a good time, even though my grand dog and I are getting reacquainted, and it's proving to be a process. She looking at me and I'm looking at her. She, she's a pit bull. She be looking at me and growling like, "You are new to our space. Who are you and why are you still here?" And I'm like, "Hopefully." She want to lick all on me. You know, I'm really not a dog person for real. So she want to lick all up. I'd be like, "Oh my God, get your dog." But she's growing on me. And hopefully I'm growing on her. And we all still breathing, so it's good.
Yeah, that happened
So
to me. My cousin had a pit bull, a Rottweiler back in the day,
mhm.
and she was fine when everybody was in the house. My cousin was like, "I'm going to the store. I'll be back." They left me and the dog. Huh, baby? That dog started growling. Guess what? We became friends because I gave her a half a pound of turkey lunch meat. I was like, "Here you go." We were friends after that. I was like,
like, just feed her, just feed her. She'll be
yeah,
your whole best friend.
and she was.
Where the
She
food
let me
resides.
know. Yeah, she let me know. Why are you still here? Wait a minute.
Oh my goodness. Oh, well, I will put that in my toolkit. Like, okay, let me give you
Uh,
some nuggets. Maybe we'll be friends. I don't know. But we're working on each other. We're rubbing off on each other, I guess. So again, this has been a great session today. Thank you all for joining. Have a happy Thanksgiving. Please spend some time with your family. Even I know things are opening up and we're nervous, and the flu and COVID and all monkeypox, all the stuff is still out there. So please be safe. Um, but show some love, show some kindness. So just remember, be safe, be kind, and don't wish for it, work for it. Until next time, which I guess will be in December. Take care and talk to you then.
bye
Bye bye.
bye. Happy Thanksgiving, everybody.
Happy Thanksgiving.